Sarel Gaur, MD. Let's talk about private practice radiology and how private practice makes you a beast of a radiologist. All right. I feel that doing private practice, it does make you stronger. It's one of these things that it's a real stress to the system, a real shock to the system. And I want people to know that, yeah, there are some issues with private practice radiology, but overall, I think if you can do it, you will come out stronger, faster, a really resilient and really capable radiologist. And that's what I want to talk about in this video. How much of a beast of a radiologist you can become through private practice. So the basic rule in private practice is this. You got to shoot everything that moves. All right, what does that mean? Basically, you've got to hunt for anything. You've got to be out there looking for anything, and you really can't say no to anything. So again, even though you're maybe fellowship trained, you think of yourself as an interventional radiologist, private practice radiology tends to be general radiology. And it's really going to depend on the local market forces, what's being desired. If somebody comes up to you and says, hey, I need you to start reading more MSK MRI, well then, darn it, you're going to have to try to figure out how to read MSK MRI, even though maybe in residency that wasn't your forte. You'll make it your business because, again, this is your business. This is your private practice. This is how you earn money. And if you're not reading cases, you're not earning money. There's no check at the end of the month. And then all those expenses, your mortgage, your other bills, your student loan payments, they don't get paid unless you get that income from the practice. And so that's where it kind of comes down to. You've got to be open to shoot anything that moves. You know, some people only want to do one thing. Like some people only want to read, for example, they may be a neuroradiologist, they only want to read brain imaging and spine imaging. Well, that doesn't really work in private practice because, someone, a new surgeon may come to the hospital and they're doing a lot of liver imaging now, all of a sudden. And, darn it, you're going to have to learn liver imaging. You're going to have to, maybe do some CME, maybe you look at some videos online, which there are a lot now. But really, if the hospital and a new surgeon's practice is heading towards we're going to be doing a lot more liver MRI, well, then you're going to have to figure out how to read liver MRI. Basically, you have to read whatever comes up on the list, and it's going to be everything. It's going to be everything. It's really like, one way to describe it, it's sort of like every single rotation you ever had in residency, but that's like every day. And every single day, you're just going to get a little bit of everything. You're going to get a little bit of body imaging, a little bit of neuroimaging, ton of ER imaging. You're going to get some fluoro studies. Believe it or not, people are still ordering a decent amount of fluoro studies. People are still doing barium enemas. You're going to do some small IR procedures like paras and thoras. You're going to do potentially some breast imaging. Now, some people do draw the line on breast. So actually, as an IR personally, I sort of drew the line there like, hey, I'm going to not read breast. But I'll tell you, there's a lot of IRs that read breast. And, more power to them. And again, that's kind of part of what makes you so good of a radiologist in private practice, that every single day you're like reliving those 4 years of residency over and over and over again, and just getting really good at everything just by design, just by the sheer magnitude of it, just every day, just pounding you with those cases. And that kind of gets into the next part of this. Private practice, you tend to read a lot of studies. I think probably you read more studies than you do in employed practice. I think in private practice, you read about 100 to 120 mixed modality cases every day. And the reason for this is that most private practices are kind of understaffed. And this is by design. One thing I can tell you that is totally true is that, unfortunately, the reimbursement per case is only headed one way, and that's sort of down. So per case reimbursement, unfortunately, goes down over time. And then also, which is that in and of itself is kind of a bad thing, but fortunately, the number of cases being done is really sharply going up as people just order more and more imaging studies. Another thing that's part of this is that, for example, another thing that's part of this is the non-physicians that are entering into medicine. And again, nothing against them, but they tend to order more imaging studies than physicians. Physicians are sort of trained as, do thorough clinical exam, history, physical exam, and maybe not order so many tests. But the non-physicians tend to order a lot of tests, especially in the ER. In the ER, pretty much wherever the pain is, that's where a CT scan is done. So imaging studies are going up. Per case reimbursement is going down. So how do these private practices stay afloat? And not just stay afloat. They could just say, per case revenue is going down, we're going to read the same or less. But what ends up happening is there's always kind of an equilibrium. You're always trying to equalize things, and basically the way that practices have made up for this is they just read a lot more cases, and this has just sort of been going on year after year. And it just sort of works. And I'll tell you, I used to think 100 or 120 cases a day would be impossible. It's not. It's actually very doable. It's very doable if you just put your mind to it. And again, just get into that private practice mindset that, hey, I'm here. I'm a professional. I'm wearing a shirt and tie, and this machine, this is my job. I sit there. I'm gonna make this work, and you can do it. And again, what ends up happening is you become a really good radiologist, just the experience. You get experience so quickly. 120 cases, that's 120 patient points in one day. Multiply that times 5 days a week, times number of weeks in a month and number of months in a year. And year after year, I mean, I would say that someone doing private practice for, say, 5 years has probably seen almost like 95% of everything in that geographic area. And that's going to make it that where when you open up a case, you're not really looking for any surprises. There won't really be that many surprises. You're going to have so much experience and so much confidence from this diagnostic workout that is private practice that you're basically going to be able to read that case quickly, efficiently, knock it off the list, and then move on to the next one. And that's what these private practice radiologists do. Day in, day out, they just knock cases off the list efficiently, and they're done at 4:30 or 5 o'clock every day. Another thing about private practice, basically, it makes you very agile. It makes you very agile because, in the fellowship, you kind of get used to doing your fellowship, your subspecialty training. So when I was a fellow, I really felt that I was an interventional radiologist, and that was it. And, I did perm cats and ports and G tubes and Y90s and venous lysis, and that's what I saw radiology as. And I remember even as a fellow once, I was thinking about dictating a liver MRI just for the hell of it, and it was hard to switch into that mode. It was hard to switch from that mode of being a proceduralist to switch over and be, you know what, I'm gonna really look at this study and not just find the HCC and diagnose it, but really look at the study and really dictate it from scratch. It's hard to switch that in and out of modes. But what happens in private practice radiology is, again, by the design of it, by the kind of the frantic pace of it, and just by the, again, shoot anything that moves, anything that's up on your screen, you gotta read it and knock it off the list. Basically, it teaches you to be very agile. It teaches you to basically respond to whatever the situation is. The situation could be a complex liver MRI. The situation could be a post-operative brain MRI. The situation could be a chest X-ray from the ICU. A situation could be a barium enema or a esophagram. And what private practice teaches you is that you can respond to all of those situations. In fact, you see those situations all as the same situation, which is you just see it as radiologic patient care. Even the procedures, to some degree, just boils down to radiological patient care. I mean, you can, and I've seen private practice radiologists do this, which is so amazing. They just, they're banging CTs off the list. They're reading like maybe 12 RVU, work RVUs an hour, and then they'll just get up and they'll go and they'll do a para in about 2 minutes, and they'll come right back to the station, and they're just, again, dictating a head CT. And for them, I don't know if they're switching in and out of modes or if it's all just become the same mode, but basically they have just wrapped their head around what it is to be a radiologist, not a interventional radiologist, not a neuroradiologist, not a body imager. They are private practice radiologists. It's a business. They see it. Every single case is just, it's a patient they're taking care of, and it's also income. It's also, there's income related to it, and they just see it as I'm going to do my job by helping the patient in front of me, and collecting the income from that in the form of billing collections. And this has become my practice, my job. So again, I have some things against private practice radiology. Just, again, my experience with it hasn't been perfect, but nothing's perfect, and I'm not asking for a perfect experience. One thing I loved about private practice radiology is when I was in it, when I was deep in it, and I was really in the zone, I really felt that this career, private practice, could make you a beast, an absolute beast of a radiologist. And I really do have a lot of respect for private practice radiologists that are out there every day, day after day, just knocking cases off the list, doing it efficiently, doing it cleanly, doing it right, getting the diagnoses that people actually care about, getting them down on the black and white, and just doing it over and over again until they leave at 4:30 and just doing it again. And yeah, so if you want to be an absolute beast of a radiologist, check out Private Practice Radiology. Sarel Gaur, MD.